Once consent has been obtained, to complete a Dilapan insertion, you will need to collect a pair of sterile gloves, lubricant, a speculum, and 5 unopened Dilapan dilators. Position the woman in a way that will help you access the cervix, such as using a pillow, wedge, or use a lithotomy bed if available. Dilapan can be inserted via speculum or digital examination. The most important point is to use the technique you're most confident in and is also adaptable to the woman's parity and anatomy. Other factors may include cervical position, station of fetal head, and maternal preference. To undertake a speculum insertion, grasp the speculum with your dominant hand. The index and middle fingers should surround the blades and the thumb should rest against the back of the thumb lever to keep the tips of the blades closed. Tell the client that they're going to feel you examine them. Then place the blade tips against the lower wall of the vagina to avoid contact with the urethra and avoid touching the clitoris or pinching labial skin. Insert the closed speculum slowly at a 45-degree angle downwards towards the small of the woman's back, whilst maintaining downward pressure until resistance is met, and then pull back slightly. Secure the speculum in place by tightening up the screw on the handle. Make use of the grooves in the sponge forceps to align with the grooves in the dilator handle so that it's held securely in place. The sponge forceps should be used when performing either a digital or speculum insertion to gain you additional length. This will help the dilators to be inserted through both the external and internal os and avoid funneling of the cervix and unsuccessful cervical ripening. The speculum should be opened and secured to allow visualization of the cervix. Then, slowly insert the first dilator through the cervix in a straight line. It is important not to twist the dilators or place them at an angle, as the woman will feel this to be uncomfortable. With the first dilator, leave approximately 1 cm of the brown part of the rod outside of the cervix. This can then be used as a guide to help place the next dilators alongside it. If the first dilator is already inserted up to the handle, it could be difficult to insert the additional rods. If this is the case, carefully pull it back slightly using the forceps until you can see or feel some of the brown rod. Continue inserting the remaining dilators through both the external and internal os until you have 4 to 5 rods through the cervix. Check that only the plastic handles can be visualized outside of the cervix. Regardless of the cervical length or station of the fetal head, the whole length of the brown dilators should be within the cervical canal to avoid funneling. Remember, you may need to adjust the first dilator to insert it fully to achieve this. Remove the speculum carefully and slowly to avoid dislodging the dilator handles. Also, when closing the speculum, be careful not to pinch the skin or pull the strings, which could also dislodge the dilators. The Dilapan dilators achieve their maximum diameter at 12 hours. Therefore, the optimum removal time is between 12 to 15 hours. To remove the dilators, gently pull on the guide strings and avoid twisting them. A speculum isn't usually necessary. They will typically come out in a clump together once they are dilated. Take a note of the number of dilators removed and check this against the number that were inserted. If undertaking a digital insertion, again, ensure the rods are held securely in the sponge forceps. Proceed as you would when performing an ARM, as if the sponge forceps and dilator are like an amni hook. In a similar way to an amni hook, locate the cervix and run the Dilapan along your finger until you are through both the external and internal os. You may feel a pop sensation as you do this. Continue the same process as advised for speculum insertion until 4 or 5 dilators are inserted. Keep hold of the cervix with your finger throughout the procedure for maternal comfort. It may be helpful to ask a colleague to place the additional dilators in the sponge forceps until you are comfortable with doing this yourself. As with the speculum insertion, ensure that the dilators are inserted fully and that only the handles remain outside the cervix and all the plastic handles are aligned. Make a note of the number of dilators inserted and remind the patient what she can and cannot do while the rods are in situ.